the people who need us, the conditions they have, where they live, the systems we've built that are working the way they were intended to work, those are not going anywhere, right? They're not going anywhere. So the work is still there. The need for us is still there. Whether or not the recognition is there, the work is still there.
Well, I'm excited. I say this every single time, but it is absolutely true. I have Dr. Deanna Wathington with me today. How are you doing this morning?
Doing well, Dr. Huntley. How are you? I'm excited as well.
Well, welcome to the podcast. We met and we've known each other for several years. We see each other in the same circles and rooms, but we actually had a really good conversation in Minneapolis a few months ago. And for me, it was like chatting with a friend, an old friend. It was like, not like we were our first conversation. And it's exciting to have you here on this podcast episode and to get to know more about you and your journey and for people who don't know you. So maybe I'm fangirling a little bit here.
Sounds
But for people who don't know who you are, would you please introduce yourself and tell us a little bit about what you do?
Wow. Okay. So, Deanna Wathington. I am a public health practitioner. I'm a family medicine doc, a grandmama of four. I am currently serving as the president of the American Public Health Association, which is an incredible honor. And I work for a small community-based organization entitled Reach Up, where we're focused on maternal and infant health and driving all maternal and infant mortality to zero.
Wonderful. That's a lot packed into those few sentences. I have so many questions for you, but like I do on these episodes when I get to know my guests, I love to start with where you are now and then roll back a little bit and find out, when did you first learn about public health? And I'm especially curious to hear from you because the majority of the guests that I talk to kind of stumble their way. They start pre-med and then they discover public health and they make a pivot. But you did complete medical school and then you went and added the public health degree on there. So I would love to know about how that came. When did you discover public health? When did you first hear about public health? And how did you decide on that journey?
I love that question because I'm actually a bit of a unicorn and I'm really happy for that. So, unlike most of my colleagues, I did not do my MD first and my MPH second. I actually discovered public health as a field when I was an undergrad. I was fortunate enough to have a wonderful woman named Fern Goodhart, who also has an MPH. She ran the Student Health Center at Rutgers University, and she needed a public health educator and hired me when I was 19 years old. So I'm proud to say that I've been in the field since I was 19. She was actually APHA's first government fellow. So if people want to read about her, they can go to that page. But she's a great lady. Nonetheless, once I graduated from undergrad, I had a job even before I graduated in public health with an entity that we would probably now call a reproductive justice entity, but a maternal and child health entity, actually Planned Parenthood. And while I was working there, went on to study and earn the Master of Public Health from Temple University. And so what I usually have to say about that is it just sets your world in a different perspective. So while I am a physician, I am a public health practitioner first, which is why I always say that, because the medicine falls within that, right? What you learn as you study public health, whether it's the core fields or our plethora of disciplines, is that everything that we do, whether it's dentistry, pharmacy, medicine, nursing, actually it's all public health, right? So you know this because you're an epidemiologist. And I think that's the perspective sometimes we are missing on the other side. And I'd like to see more of that.
Oh, I love that. You're speaking my language. I think that is fascinating. And so when you completed medical school and you said family practice is your
Yes.
specialty, so you practiced for a while in clinical setting?
Absolutely. I practiced in academic setting probably the longest. I'm still a professor in collaborative status at USF Health, one of the team members who helped actually bring USF Health to reality. And I'm particularly now focused in the College of Public Health. And so I'm still licensed in the field, of course, still do all of my CMEs, et cetera. But because I'm working now with this CBO, we're really focused on how we impact maternal health and infant health in ways that we have now seen are evidence-based, right? So we have a team of doulas, we have a team of home visiting nurses, we stay with our families up to 2 years after the birth of the baby. Our families return to us when they have another baby. And we have a father's, well, actually, you have more than one father's program. So the entire family, we call it a whole family approach. The entire family is part of this process of ensuring that the mom and baby are healthy. We have a mental health counselor, we have a social worker. So we try to bring all of the pieces that complement and augment, the medical services that the patients receive, while we are also linked to those medical services. So we have partnerships with our local hospital systems. Our doulas are welcome there, with our local Healthy Start, on and on and on. So
So this is Reach Up, right?
this is Reach Up, yeah.
My goodness. Is Reach Up only in Florida?
Right now, yes, we had three wonderful women founded Reach Up, and we love them. I've known them for a very long time, but we are now under the leadership of a new CEO. And so we are looking to continue to build our reach beyond the state borders. We see some places now engaging in what we've been doing for about 20 years, which is all of our services that I just stated to you are offered free to our community. So we receive other types of funding that supplements what we're doing and enables us to provide all of those services to our families for free.
We do need that. We need that at least one in every state.
Yes, yes, right. Sorry, that's my most recent. I know you want to talk a little bit more about the past, but yes. So I did. Let me go back to that. And I've
Yeah.
also been in private practice, and part of being a public health practitioner is that means I've always included all people within my practice. You didn't have to be insured. And so I just think that's such an important approach, even in this age of managed care. I must say that I'm not, the biggest fan of how we are delivering healthcare in this country. I don't think that it is indicative of providing, how can I say, services in the best interest of everyone's optimal health, right? And
Hmm.
so there are ways in which we can do that differently. I know there are many people speaking about that, but certainly being in private practice gave me a real eyewitness view
Yeah. Yeah.
of how that occurs. So, yes, I've been in academic practice, I've been in private practice, and then I also was with the state health department for some time.
Yeah. That to me, just I imagine, and I focus a whole lot on these, folks with very diverse backgrounds, this interdisciplinary, professional. So you see a lot of gaps. You're really well aware. You probably have a lot of ideas about, how we can fix these things. And from listening to you, I could assume, but I don't like to assume. It definitely sounds like your heart is, maternal child health. But I do want to ask kind of directly, is there a particular population or issue or problem that you are most passionate about now?
Yes, I don't, so I don't know that it's necessarily changed. Maybe I've added some pieces to it. So I've always been working in this field that people now call health equity. When I started in the field, there was no such thing. Actually, the secretary of HHS had just instructed her people to sort of stratify the data according to, quote unquote, race and ethnicity. So that was a long time ago, the 80s, as you may remember.
Right.
And so I've always been focused on, how we even the playing field, how we even the living field, the quality field for people of color, particularly the African American community, particularly the indigenous community. And so I just love your work with, the tribal
Yeah.
centers. It's been really wonderful to see. So I think, so I'm still in that place, and I still am concerned about those populations, as well as obviously our Latino populations and our immigrant and refugee populations. And it's actually part of my priorities, part of my priority list, excuse me, for this year as I serve in the president role for APHA. But anybody who knows me from APHA knows that I've been engaged in that work for a long time.
Yeah.
So yes, I do focus, or I'd like to focus on those populations, although certainly everywhere that I have worked certainly cares for every population. And certainly what I tell people is we hear a lot of talk about trickle down theory in economics, right? And
Hmm.
there are many skeptics of that. I'm probably one of them. However, what we do know and what we have great evidence for is that when we help folks who have the highest mortality and morbidity rates across whatever spectrum, whether that's chronic disease, whether that's, emergencies, whether that's maternal and child health, that effect trickles up, right, to everyone, to all ethnicities, or all, in this country, as they say, races. I don't use that term, but
Right.
that trickles up to everyone. So the positive effects just bloom outward, right? We know that. And I'm just really committed to us learning from that and continuing to practice within that and building models that do that. And I think that a lot of the work that we do around determinants of health enables us to have a foundation to do that.
Yeah. So I'm going to lean in a little bit
Hmm.
on that because I definitely agree with you. And I think that people who are like-minded, it's easy for us to see it. We get it. But there are a lot of people who really don't see how if we, address this, or there's maybe even still deny that the problem is as big as it is among these ethnic groups, or, but they also, if they kind of see it, they want to blame it on something else, and they don't quite see the importance of pouring into addressing the problems in these groups and
Hmm.
how this could be a bigger, how could trickle up or have a bigger impact that way. So because of that, there's frustration right at that intersection. So there are people over here that get it and we're trying to do the work. And
Yes.
there are people over here that don't see the significance or the importance. So they're not supporting that work.
Hmm.
Sometimes we could say they don't care, but maybe they just don't get it. What do we do about that? Because it feels like we're fighting the giant. And I'm going to even add this layer because, the timing of this episode now, we're recording at one point, but by the time it comes out, we have a new presidential administration that, from a lot of different angles they appear to be of the camp that doesn't quite get it. So how do we even address that? It almost feels very defeating to get up and go to work every day. It's a big
Yeah.
question, I know, but I just
Yeah.
I just want to know your thoughts on that.
So I hear you. It does feels defeating. It feels withering in a way, right? I think that a lot of people were feeling that through November and into the holiday season. And I've been fortunate enough to travel around the country during those weeks. Actually, I started right after the annual meeting in October,
Yeah.
and needing to deliver a message and keep folks connected to the work we do in public health. And so I think that what we have to remember during this time is that we have been through many tough times, right? Maybe not in our lifetimes, but actually we have in our lifetimes. We can talk about HIV, we can talk about, drug addiction, we can talk about all of the ways, all of the things that we have faced down and try to ameliorate. And I think we've also faced circumstances in which we've had people, administrations, our systems, right, that do not necessarily think that the work that we're doing is key. And what I've been saying really is that the people who need us, the conditions they have, where they live, the systems we've built that are working the way they were intended to work, those are not going anywhere, right? They're not going anywhere. So the work is still there. The need for us is still there. Whether or not the recognition is there, the work is still there. And I think that over time, so I think two things. I think that I often talk about with our communities, and we all talk about it, having trusted liaisons within those
Mhm.
communities, right? That they're trusted by that community who can perhaps tell the story in a way that people can't hear you, but they can hear them. So that's one. I don't think that we should give up on that.
Right.
The second is that I think over time, unfortunately, it may take time, people will see that these structures that we've created that protect us, right,
Mhm.
are necessary, especially if you begin to dismantle them. I think you will see that fairly quickly.
Yeah.
And there's a rhyme and a reason to all of it, despite the conversation around alternative facts, right? So this is the conversation I've been having going forward, right? We still have to do the work. We still have to do the research. We still have populations that are depending upon us. And while it may be difficult for us for a time, it has been difficult, right? Really. It's been, and even if we just take recent history, just since, 2020, it's been quite difficult,
Right.
right?
Right. Right.
So we're still here, we're still standing. And, I say to people that I think it's knowing the value in your work without the external approval or pat on the
Mhm.
back, knowing that we are the glue, essentially. I always say we're the role models, we're the protectors,
Mhm.
we're the invisible and silent shield, right? And it's only when we're not there that people are like, oh my God, we need them. Where are they?
That's right. That's right.
So I just don't think that part of our work will change, regardless
Yeah.
of how people are viewing us right now.
Yeah. What I'm hearing is these reminders of the word resilience. Like we are a resilient, industry, profession, group of people,
Yes.
and just leaning into that as we go into this, difficult season. Well, we're already in it, but as we continue to move and just leaning on the resilience and the stories and the wins that
Yes.
we, like you said, experience in our lifetime, because that's very helpful to kind of help you feel like, okay, well, yeah, we've been through this before. It's tough. I don't like it, but we've gotten through this before. We can get through this. We can still do this. And it does matter. We know it's important, even if the others don't see it quite yet. We have to keep showing up. So
Yes. I talked
that's
about that
encouraging.
a couple of months ago. I mentioned that we are resilient. It's one of our greatest traits, right?
Hmm.
But that even folks in their resilience get tired, they become weary, right? That's one of the conversations we even have in the how can I say it, in the world of African American women, right? That's an often
Right.
a
Right.
conversation, but that's true also of public health professionals. And I said, so why do we really keep going? And I think it's our resolve, it's our resolve, it's our strong belief in, it's our standing on the truth that what we do really matters,
Yeah.
and that's how you kind of push through.
Yeah. Thank you for that. That's personally was very reassuring for me and encouraging, but also I know that my audience will appreciate that too. Yeah. Let's talk a little bit more. You touched on some of your work that you do right now with Reach Up, and I've already put in my bid for, we need to have one in every state.
I love
Let me know how I can be a part of making that happen.
that.
But how long have you been there, and tell me just a little bit more about what you do there?
So I've been at Reach Up a little over 2 years. I am the clinical director. So all of the nurse home visitors are my colleagues within our division. I have a thing about saying that, you know, people they report to me. No, they're colleagues within my division. The entire doula team as well, colleagues within my division. And then we have, I guess people might call them navigators. We call them maternal health specialists, and they actually sit in the sites of our clinical partners. And as patients come in and are diagnosed and seen, then our team connects them to the necessary services at Reach Up and across the communities. We obviously deal with those issues such food security and housing security. We ask all of those determinants of health questions and try to ensure that people are connected. And then again are within our home visiting services so that we can support the family through the first 2 years or so. So it's joyful.
Yeah.
That's really my work. We've been very successful, I think, as an organization over the years that the entire organization has been in place. We've really had an impact on infant mortality rate, and now we're focusing on, with the new leadership, also on maternal mortality. So that's that. So I've been there 2 years. I don't know if you want to talk about prior to that. There's a lot of years prior to that.
Yes. Yeah, fill in those gaps.
Okay, so prior to that, I served as the founding dean of the College of Health Sciences at Bethune-Cookman University and had the pleasure of building college for just some wonderful students there. We offered a variety of health science degrees, a Master of Public Health and Health Equity, which was the first Council on Education for Public Health accredited MPH in health equity in the nation. We also offered a number of master's degrees and an undergraduate degree in exercise science, a master's degree in mental health counseling, a master's degree in athletic training, which was also nationally certified by Katie, and an undergraduate degree in gerontology, also nationally certified. So nationally accredited is the words that I should use. And I stepped into that role from where I was prior to that was with the University of South Florida, USF Health. At the time that I stepped into the dean role, I had previously been serving as the associate dean for academic and student affairs within the USF College of Public Health, which was one of the greatest pleasures of my life. Just an incredible experience, incredible students, incredible colleagues, and hence, which is why I'm still a part of USF Health.
Yeah.
And then prior to that, I served as director of minority health for the state of Florida, the first director of minority health. Yes, so I have had some stories. And then I've also served as an associate dean in the College of Medicine at USF.
So
Here.
I didn't realize how big USF was. My son used to live in Tampa, so we were down there all the time. I began to get sort of a taste of it, and then also I have met. Oh, I know a lot of students who are in MPH program there are listeners of the podcast because I would get messages and people would let me know, where they attend school and so forth. But I think with Florida, I have kind of a couple of questions, I guess, because you've been in a couple of different roles, the academic role, in the state government, now with, the community organization. And you mentioned you were Office of Minority Health. I know in our state, I think they've done away with Office of Minority Health. I'm not sure if they call it something different or what they've relabeled, but you were starting to describe the dynamic of your team and the doulas, and then you described a position, and I can't remember the title you used, but it made me think of community health work.
Yes, yes. Yes, very much so. And we do have some positions like that. I would say that if we're classifying what my maternal health specialists do, are probably more along the lines of navigators and care coordinators to ensure that people are hooked into the correct services. Although certainly, yes, I think that title of community health worker could suit them as well.
Okay.
They're great. They're a terrific group of people. They also possess either a master's of public health, and I have a mental health counselor in there. I have a social worker.
Yeah. So are community health workers, and this may not be familiar with enough with this there in Florida, but I know in Texas, they seem to do really well with community health workers. In South Carolina, we're lagging way behind in really being able to bring community health workers into clinical settings and where they can kind of leverage, their expertise and be that frontline. But are they more received and utilized in Florida, or a little bit more progressive as opposed to maybe where we are in South
I think
Carolina?
I'm biased on this respect because I've worked so often and for so many years with community health workers. I started, wow, I guess it was probably way back in 2009 with community health workers on a cancer health disparities grant that we had from the NIH. And again, that trusted voice in the community, those were our community health workers. I think it's really blossomed from that time to be present across the state. So much so that I believe that the state Department of Health now also provides an exam and a certification for community health workers. So it's really just a part of the fabric of how we deliver, and keep people healthy in our communities. I would say that I don't know of a county in the state that does not utilize community health workers in some fashions. But of course, and essentially it's policy now, right? It's part of the State Department of Health, and so.
That's
But that's
wonderful.
been a while coming.
Yeah, that's wonderful. That's wonderful. I know I've been so it feels like all over the place with the questions, but essentially these are things I've just wanted to know. This has
I do
been,
want to say that for South Carolina, the National Association of Community Health Workers they're a wonderful resource. So just
yes.
have to give them a shout out. Hi,
Yes.
Denise.
So we are actually wrapping up a project with the Department of Health, Public Health, in kind of what we would, I guess, typically call like a landscape analysis. Really seeing what other organizations and partners would be interested in working with, who'd be interested in working with community health workers. How's it going, or what is the hang up? Just kind of getting a real good sense. And then partnering with the South Carolina Community Health Workers Association to help kind of facilitate that and support them. Their office actually is in the same building as my office. I have an office downtown as well. So I've been known to pop
Great.
in and kind of, how's it going?
Good, good.
and chat with him. I'm not sure when. I'm just a real big fan, and I really want to see that utilized more in South Carolina. And I
Yes,
just have
yes.
just been raising my hand to be a support and advocate in some way. So maybe, I don't know. I'm not going to call it a passion project, but maybe it's just a bit of a calling. But I've been really working on that for since the middle of last year. We're kind of wrapping up that project. So I'm hoping that once we kind of complete that report and project, I can talk a bit more. I'll share a little bit more on the podcast. But that's why I went down and asked the question. It's a little bit of a secret passion that I have now to get, to bring to really have community health workers more of a common, phrase and name for people. And this is a very rural state, but I live in a very rural county. So I think that there could be so many advantages to having community health
There,
workers.
there are. I can tell you from experience that, there are, and I'm certainly encouraging you in your efforts. Again, you don't even realize, how prevalent it is until someone asks you now, right?
Right.
Compared to what we had before. So I'm kind of proud to say that.
Yes, yes. Well, this has been such a great conversation, and I've appreciate your generosity and time and just sharing so much. I guess as we begin to kind of wrap up a bit here, we've had you've been a listener of the podcast, and you've heard me say this. We have a very diverse group of listeners. So we have, practitioners, professionals from all angles and stages of career, and we have a lot of students listening. But do you have just a bit of advice for anyone listening who may be interested in some of the same things that you spoke about and some of the things you've done? Just some advice that you could share with someone listening.
Yes, I think my biggest piece of advice right now, if you're interested in some of the things we've been talking about, is if you are not already a member of the American Public Health Association, please become one. We are the preeminent public health organization in the United States. We represent public health policy, not only at the state level with our affiliates, but on Capitol Hill. But we are also sort of this umbrella that encompasses all of our fields, right, Dr. Huntley? So we literally have 34 sections, and I'm not even sure that that's enough to represent all of our disciplines, from epidemiology to community health to maternal and child health, and on and on and on. And we have quite a number of caucuses as well that represent some of our groups that help us move in ways that bring optimal health to everyone. And we also have a number of forums. And so I think there's a place for everyone within APHA, and it's a place to learn, right? Especially if you're interested in the things I've been talking about. It's a place to act. We certainly are happy. Please attend our Policy Action Institute, and you'll learn how to interact with your legislators if you don't already know how to do that. I think that the networking provides the biggest benefit, because then you meet people like Dr. Huntley, who is a fantastic epidemiologist. And if you cannot see sort of the interconnectedness and everything she does with the podcast, etc., please come to APHA and find out.
Yeah.
She's a great representative of it.
Yeah. Oh, I agree with you. I say it often on this podcast, but I've been active part of the leadership team within the epidemiology section for several years, and I attend, every year. And this past year was our first time hosting a booth. We had a booth, and I brought our team. And did you get a chance to make it through the booth and see our?
I did not
You
get
did.
to
It
go
was it was
through.
such a busy time.
It was very busy.
We had a lot of people who stopped by and were like, "Oh, I listened to the podcast," and then we go into conversation. So we had two of our team members there because I was also bouncing around between sessions and different things. Just, to your point, all the things you said about, the association, there's so much to learn. There's a huge investment to be present at the events,
It
but
is.
it's so worth it every single time. I mean, the connections, the learning, there's just as much as you put into it, you get back multiplied, really.
That's
So
right.
yeah, this is turning into a commercial for APHA, but
I'm sorry, but that's partly my job. I do want to say this, though, that even if you can't come to the meetings, and we would love for you to do that, when you're a member, we provide webinars really all the time. The webinars are free for our members, and other opportunities to learn remotely, so that you don't always need to be in place. I certainly would encourage you, though, to be a part of your state affiliate or your territorial affiliate, so that you can go and network in person. And one other word I'd like to say is just you'll receive emails from a young man named Donald Hopper, if you're a member, and he's usually asking you, encouraging you to please send letters to your legislators on behalf of the public health issues that we all hold dear. And it's painless, right? So I'm just encouraging you, please, when you see that email from him, open it. The letter will be sent automatically for you. You basically just have to say yes. But it makes a difference that we speak to our legislators, especially as we move into this new era, where again we had this conversation about people maybe not appreciating the work that we do. And I think the more of us that speak in that manner will help move the ball a little bit. I don't want to sound Pollyanna-ish, but I do think that it's important to educate people. So I think that'll be my last piece, but we call that Speak for Health. So if you go to the website, please look for policy and advocacy and click on the Speak for Health page, and you can learn much more about our priorities and what we are trying to achieve for all of our populations.
Thank you for that. We'll also share that link in the show notes to make it easy for people to get to.
Thank you.
Thank you so much. This has been a lot of fun getting to know more about you and your journey. And thank you for allowing me to kind of go in all random order, so to speak. But it's been so much fun to get to know you. I really appreciate you and all that you do, and wish you well as you continue on your rest of your term as president and all the things that you do beyond.
Thank you. Well, I appreciate you, Dr. Huntley, and I will continue tuning into your podcast. I love it. So, and I think I have to add the second one too.
All right. Sounds good.
Thank you.